which is 6.4, presentation of proclamation designating the 31st day of August 2025 as International Overdose Awareness Day. Supervisor Sabatier will be reading this proclamation. If you're here on behalf of this, please come up and join Supervisor Sabatier.
Please come on up.
One's for health and one's for behavioral health. That's helpful.
Good morning, everybody. Today is a proclamation designating the 31st day of August as International Overdose Awareness Day. Whereas International Overdose Awareness Day is a global campaign held on August 31st to end overdose, remember those who have died without stigma, and acknowledge the grief of family and friends left behind. Whereas in 2023, 28 people fatally overdosed in Lake County, which was the 7th highest overdose death rate in the state of California, and is 2 times higher than the California rate. Lake County's rate was 43.8 per 100,000 compared to California's rate of 20.81 per 100,000 deaths. This data came from the California Overdose Dashboard. Whereas every person should have access to resources that prevent overdose and other causes of drug-related mortality, including naloxone, sterile needles, drug testing, and medication for addiction treatment. People who use drugs continue to be stigmatized and marginalized, discouraging them from accessing care and treatment. Whereas, in Lake County, dedicated prescribers of medication for addiction treatment, harm reduction providers, behavioral health providers, and addiction recovery programs work tirelessly to provide residents with these resources. All overdose deaths are preventable via access to harm reduction, health care, substance use prevention, and treatment services, and naloxone, the opioid overdose reversal agent. Whereas local communities play a crucial role in eliminating the stigma of addiction, including residents, elected officials, parents, private and public organizations, hospitals, law enforcement, first responders, schools, and colleges. And whereas, and maybe even bus drivers soon. And whereas SafeRx Lake County, an overdose prevention coalition comprised of local agencies and organizations, including Lake County Behavioral Health and Lake County Health Services, will host its 5th annual commemoration of International Overdose Awareness Day in Library Park in Lakeport on Saturday, August 23rd, 2025, from 11 a.m. to 3 p.m. Now, therefore, be it proclaimed that the Lake County Board of Supervisors does hereby designate August 31st as International Overdose Awareness Day and urges Lake County citizens to join in this important observance. Passed and adopted on this day, the 12th of August, 2025, and signed by our board chair.
Here we all are. No, we're supposed to speak now.
Please.
Good morning, members of the board and community members. Thank you for this designation of International Overdose Awareness Day and taking the time to honor the lives lost to overdose, support those in griefs, and recommitting to prevention of future tragedies. In our rural community, we felt the pain of overdose deeply. These are not just statistics. They are our neighbors, our family members, and our friends. Behind each number is a face, a story, and a life gone too soon. While today is heavy, it is also about hope. It's about breaking the silence around substance use and overdose, reducing stigma, and ensuring that help is available and accessible for all. It's about making sure that every person, no matter where they live, has access to evidence-based care, harm reduction services, and the dignity they deserve. For many years, stigma kept too many people from getting the help they needed, but together, our community has been breaking down those barriers, opening doors to treatment, harm reduction, and hope. Because of that work, we've seen a remarkable shift. In the last 5 years, our county has moved from the 2nd highest overdose rate in California to the 7th, and from 4 times the state average of overdose to just twice the state average. This progress shows that change is possible and lives can be saved. To continue this progress, SaferX has worked to ensure that there are accessible naloxone stands around the county, which hold free life-saving medications for community members to arm themselves with in any instance of overdose. I want to take the moment to share that although some may believe naloxone enables drug use, this has been researched and is simply not the truth. There is no data to show that communities with widely available naloxone see increases in drug use. We also know that the burden of overdose is not felt equally. In our state and community, Latino men and Native communities have been disproportionately impacted. Due to historical racism and underserved populations, these communities more than ever need to be prioritized in prevention, treatment, and recovery efforts. These efforts must be culturally relevant, community-led strategies that honor traditions, reduce barriers, and ensure that no one is left behind. This day is also about continuing that momentum, creating meaningful conversations around substance use, and ensuring that people know help is available, and making sure every person has equitable access to harm reduction services. SaferX works alongside organizations doing direct service such as naloxone, syringe exchange, safer smoking supplies, test strips and drug checking education, medication for addiction treatment, and more. We cannot bring back the lives that we've lost, but we can honor them by working together across agencies, families, and communities to prevent more losses in the future. SaferX will be hosting the 5th Annual International Overdose Awareness Day event in Lake County on August 23rd from 11 to 3 in Library Park. This day is to commemorate the lives we've lost. Naloxone training, art projects, resources, and speeches from those who have been touched by this tragedy will be available. If you'd like to honor a loved one, please join us to decorate a headstone. On behalf of the Health Services SaferX Coalition, I'd like to thank the board for recognizing this important day, for standing with those impacted by overdose, and supporting the efforts that do save lives. Thank you.
Anybody? Go ahead.
Yeah, I just want to thank all of you for your commitment. As you mentioned, we're doing better than we were, but not the place that we're going to stop. I think it was last week we approved, in the last 2 weeks, we approved all of these contracts for increasing the services that we're providing here because we've recognized that this is an issue. We're facing it head on, and that's really how you make change. And so all of you are doing the heavy lifting and that hard work out there. So I have a lot of gratitude. This is a really difficult topic. There is a lot of stigma. We've experienced a lot of tragedies. But it's not something that we can hide from. We have to face it and work towards it. And so thank you all for the work that you do.
Vice Chair?
Yeah, I appreciate everybody's work. I think one of the significant reasons for the improvements that we had is because of the collaboration we have in this county with our, not only our public agencies, but also a lot of other nonprofit, non-government organizations that are out there helping. And we can only continue to help and get it better by continuing on that line. So thank you.
Supervisor Owen?
Wow. I was feeling pretty hopeless when I had seen that we were 2 times higher than the state average until I had seen, you guys had just mentioned the statistics on where we started from. And I didn't catch the date on that. 2019, 4 times the state average, and to improve and cut that in half, that's pretty impressive. So kudos and thank you so much for what you're doing. There is a stigma here, and you guys are working really hard to improve that, and I'm very impressed. So thank you for what you're doing.
Yes. It's one of these things where there's a lot of overdoses on Indian country. I just wanted to highlight that. But I also, I don't want to leave out the full county. But one thing that I really want to accentuate right now is that, I feel like we're a little downstream here. We're trying to, catch it when we can with naloxone and all of the other measures to try and prevent someone from losing their life. However, if there's a lot of folks that are considered overdoses which were actually murdered. And so because of the sale of it or whoever gave it to the person, some people are just constantly. That's just their lifestyle. They're addicted. But then there's some that are trying new things or just poisoned or whatever the case may be. So for me, my hope is that people that are affected by this and know if anything had happened to please reach out, because either specific people are the only sole people going down for these things, and others are out there still selling this drug and still giving it to people, and this just creates the same cycle. And so if anyone has any information, please be brave, be courageous, and turn these folks in so we can get to the root of this and catch it upstream more. I'll open it up to the public if there's anyone out there that wants to speak on this. All right, no hands in Zoom. I'll bring it back to the board. If there's anything else to finish on. If not, then we have a picture that we need to take.